Welcome so much. Thank you. Tell us a little bit about this vaccine, its effectiveness. How soon will we be able to get it to the people across this country?
Hi, Joe. That's definitely a victory lap. Look, this is a scientific marvel to have a vaccine ready in such a short time. And it couldn't come at a more dire time. Look what's happening out there, where the numbers are going. We are really at a junction point because in one hand, we have this amazing news, a vaccine being ready. And on the other side, we have the number of cases going up and with no end in sight. But let's look at what's happening next. What are the next steps that we're expecting to see? FDA is, as we know, has approved, gave a green wave to Pfizer, and we're going to have the first rollout as tomorrow. 2.9 million doses will go to 145 facilities in the United States, and we are expecting another 3 million doses on Tuesday, going to another 450 facilities. So we should see the first shots going in the arms definitely on Monday. Well, but keep in mind, go ahead.
Well, no, I wanted to pivot a little bit because obviously here in New York, it was just announced by Governor Cuomo himself that they're going to be ending indoor dining here. Obviously, across this country, we've seen a push for this increase in restrictions as we've seen a rise or spike in these cases. Obviously, they have problems for average Americans trying to make a living. Do these restrictions actually work? Are there other things that perhaps we should be focused on, whether it's overcrowding in public transportation, whether it's us trying to realize that the restrictions on public activities only drives the need for people to engage in private activities where there's less social distancing happening? What is your take here?
The most majority of spread does occur in small family gatherings, when friends get together, family get together. So the point here is that restricting indoor dining would limit these people to congregate together. So I see the point there. I mean, this virus will not disappear magically. We need to do something about it. And it starts with preventing the spread at the basic level of when it comes to people interaction. I think, to leverage the people who are dying on one side and the business on the other side is not a fair equation. You can't put a dollar sign next to a patient that's grasping for air. The same, how do you quantify a business who is grasping for last breath as well? I think the answer has to come, how can we help both of them? How can we find a solution to survive and bridge this time until we have vaccination at the larger scale?
Right. And to that point, we talk about the vaccines and how close we are. But obviously, vaccines are not a silver bullet. And we still have to talk about treatment protocols and putting more money into treatment so that we can make it through this bridge period before we get to the type of or levels of immunity required. What are your thoughts on where we are right now with the treatment protocols, where there's less people who are actually dying from COVID, even though we have more people getting sick? But what are the things that we can be doing between now, us trying to finally approve the vaccine and us getting deeper into this process where more people across this country and around the globe have actually taken it?
Definitely. Keep in mind that vaccines will roll out in the next 2 months to the most vulnerable groups. They comprise 40% of mortality. So that's important. That's where the bad numbers are coming from. Also, healthcare workers will have a more solid force to be able to handle and cope with a number of patients. On the good news side, indeed, the mortality has been down significantly since the beginning of the pandemic. At that time, we were actually quite high, about around 6% here in New York alone. And now we are somewhere still around 1.8%. And mortality has been down for a few reasons. One, we are doing more testing. Number two, we have more tools in the pharmaceutical arsenal, so we know how to treat it better. And third, the demographics have changed. It's a much younger population, at least 10 years younger in a few months span. So indeed, mortality is lower, but we are not out of the woods. 1.8%, it's still so much higher compared with the flu, where it's around 0.1%. So keeping those numbers in perspective, this is still a deadly virus that's preying on the elderly and vulnerable.
We'll have to leave it there. Dr. Luiza Petre, always good to see you, my friend. We'll have to catch up soon.
Thank you.